Good afternoon. Today is March 3rd, 2023, Friday. This is UMACO TV. My name is Kemal Erkan. I'm here with Sean Donovan. Sean, how are you doing?
I'm doing great. Kemal, how are you?
Good, very good. So we have our weekly session. Today we are going to cover healthcare-related items as well as global and U.S. economy. We are going to start with COVID. I know we were just giving regular updates up to now, but the news right now is changing where origin of COVID, now we have different findings. So we're going to talk about those. Well, you're on.
Sure. Yep. So as you were mentioning, normally we just hit on the statistics of caseload, mortality, and then also vaccination, which just to be brief on that, the numbers are holding steady. So not alarming, no spikes. So that's obviously a good sign. But as you mentioned, the news is kind of the hot spot for this week's COVID update. So the fact of the original idea that it was leaked from a lab in Wuhan, China, has now been released from the FBI in their investigation. That is it went from like very unlikely to moderately likely to then now very likely. So there was the FBI and then a few other agencies that conducted their own investigations, but the conclusions that it is at least moderately likely, if not very likely, that the source is from that lab in Wuhan. So we know that's what the original speculation was back in 2020 when Trump was saying coming from China. And then now these findings are actually supporting that.
He was calling like China, and everyone was making fun of him. But it seems like he was right.
Yeah. So everyone, like you're saying, was trying to get him, I guess, in trouble or saying, it's Chinese virus. But when it comes down to it, that investigation was supported.
I wonder why government would hide this. If this was, what would have changed if we knew it was coming from China or not?
Right.
Like, what do you think that they were hiding this for?
I mean, I know obviously you don't want to hinder relations, especially if it's already on edge with a country like China. I guess if it was in a different country of origin, maybe in Europe somewhere, they'd be, less on edge or worried about calling it safe. If it was from France, saying the
but
French.
We didn't have these relationships with them already.
Right. So I think
putting financial sanctions on them, and like if this was coming from them, and our president at that time was saying that this was originated there, why would the media be? Why would they hide this?
That's a good question. Not sure what the benefit is there. Obviously, from a healthcare standpoint, if you know the origin and kind of where the people who were originally infected with it and what their symptoms were, and you can focus on there, obviously it would help preventative care looking ahead in the future on how maybe you can combat the spread or combat the symptoms or what the management's like, or even just how the disease or infection actually progressed in the person. So if these people have had it for months, how are they doing 3 months later, as opposed to everyone kind of worried about calling it this and that, whereas I think the healthcare benefit is actually more important.
I think my problem usually with these is that if you have a strong feeling about these things, right, so one should be able to say that. So when we get so much blame for what we think of, like if that time I was being blamed for a lot of things, for like supporting Trump or supporting vaccine or not supporting vaccine, you couldn't actually have you couldn't actually really just have a discussion. It was just like, as soon as you start talking about this, someone would try to shut down what you're saying. But I think if this would be beneficial in a way that, but you may have a different opinion, different view, but the only thing that we need to do is just listen to each other and then see if this would help the current situation. Knowing where this is coming from is important, because if this is some lab-made virus that made everyone's life miserable for the last 3 years, well, we have to keep those countries accountable, and we have to know. I mean, you can't take that from us. So I want to share one real data from our admissions, and these are not all COVID related, but just looking at how it's changing the behavior of the public. This is the ER numbers for 2 months of last year and then this is 2 months of this year. As soon as we have less risk in the ER, like getting infected,
contracted,
and the hospital. So right now we went up to 4,857 admission / ED visits. The same population we have, it was 3,600. So this is about 33%, almost 33% increase, which is huge. But also all those people who lost their lives, everyone who was struggling at that time, including myself and our company. But we have to know, this shouldn't be like 3 years later, oh, by the way, Trump was, right. By the way, everyone was supporting Trump that time, or kind of agreeing with him that time, were evil people, including myself. So now, 3 years later, is anyone apologizing to Trump? No.
Right.
I think we have to be more responsible for what we say and what we do. Now, the other interesting thing here is, I don't know if you mentioned this one, but Elon Musk actually was warned by the Chinese government.
Yeah, that's kind of ironic. You just mentioned that, being able to provide the necessary information to the public. And now we see the Chinese government was warning Musk about sharing that lab report, because as we know, his involvement with Twitter and how that's such a big media outlet for people to actually access their information. So kind of suspicious activity right there that they're saying not to leak the lab report. What are they trying to hide? And again, if it is man-made or intentional, obviously that would have much different response from the rest of the world, and at least from the US especially, on how we would deal with that. And because, there was everyone up in arms about, oh, you're putting on these travel sanctions from people from China, you're discriminating against, that particular area as opposed to other spots in the world. So I think it is definitely significant information. And the fact that
this warning, is it something new, or was it because Elon Musk? I'm assuming that this is with the Twitter connection that they were.
Yeah, I think it's relatively recent. I know that article was just at the end of February that was published. So I'm assuming it's with that investigation report being released that they then responded and telling Elon, or warning Elon.
So it's a good lesson learned. So again, the discussion is important. So people really need to listen to each other without making other people, like, just because they disagree with you, that doesn't mean that they are crazy. They just have a different opinion. So you have to listen.
I agree.
So, all right. Anything else on the COVID side?
No, but I mean, just our main takeaway right there is that lab report. We'll see if it does get leaked. Maybe not Twitter. Maybe another source will get it out. And I'm sure there's vital information in that report that is very impactful to the world.
And Elon Musk has a lot of financial ties with China, I guess. So
that's true too. With Tesla being,
he won't be able to share everything.
A lot of outsourcing there.
So. Interesting. So we'll see. All right, so, let's go to our next video.
Sure. Yeah. So another thing we like to incorporate here is just some recent news articles or releases that we see related to healthcare that kind of grab our attention. So we have a couple here. The first one is regarding a top surgeon being the whistleblower. So the top surgeon is required to pay $8.5 million from a whistleblower in the suit that happened a few years ago. I think it was when initially filed. I believe maybe 2019 or 2020 is when the suit began, but now just recently coming out with this verdict on it. And looking into it is kind of, I guess, not confusing or puzzling, but on how the fact of the surgeon being charged for operating in multiple operating rooms at the same time and how he's billing for those, and kind of just how something like that could happen. You'd think in modern healthcare that people be on top of this type of management, and how something like this could actually unfold. Especially this was at the Mayo Clinic too, so you'd think of a prestigious organization.
So sometimes evil is in the most safest places. So let's actually, I just want to put this slide up there first. So this is what we are talking about, right?
Correct. Yeah.
The hospital here is Mayo Clinic. Top surgeon to pay $8.5 million in whistleblower.
Yes.
So now you were asking.
Yeah, you're thinking in modern healthcare that things like this you think there's no way possible that?
Okay, so we want to explain how this is possible. So,
Yes.
so every time we hear these types of news, so the news again is the surgeon with the hospital system, they are doing cases at the same time, multiple cases at the same time, and they are billing. And there's 8.5 million was awarded for the whistleblower, or they were to pay that much. We don't know how much whistleblower is getting. So I can give you some background on this issue, even in our local hospitals. So as you may remember, I mean, you weren't here in United Medical, but you may know from what we have done in the past, we have a group called Surgeons for Emergency Care. And also we have a lot of surgical groups who are part of us. Surgeons for Emergency Care would provide, designed to provide emergency services. And they were on call 24/7. There were 7 different groups. I put them into one for the on-call purpose only. And that was one of a kind. There was no other group in that setting in the United States in the surgical setting. So we were competing with the hospital employed surgeons. What we were competing was like the way that we are being treated, the way that we have access to block time. Block time is for the OR. Yeah. Now, just because you have 24 hours doesn't mean that you do cases 24 hours. Sure. So those are the things that we kind of like public may not know. So what happens in the OR time, OR block time is the most popular time are morning, like 7 a.m. So because everyone wants to get in and do their cases. And in most cases, emergency cases are staying overnight. Again, like you as the patient profile, you would be like a perfect candidate for an appendix surgery because you are 24 and male, and you have like the standard qualification for that. So if you were over 40s, it would be for gallbladder. So because no one is over 40, so we don't know anyone who would qualify for it. But let's focus on the appendix. Average wait time at Christiana Hospital in 2014, and 2015, and 2016 was 9 hours. Wow. So you would go for the emergency, and then you would actually, they would stabilize you, and then you would wait for the surgeon until next morning. Wow. And 9 hours. So now, again, actually, this is something that I write about in the work the book that I'm working on. Christian Hospital, again, they have 20 ORs. These are 2016 numbers. From 7 a.m. to 5 p.m., they would operate on all 20. 5 p.m., they would go down to 10. They would go down to 5. And then 11 p.m., they would go down to 2. Like 2 OR, from 20 to 2. And then those 2 were reserved for the trauma cases. Right. So if you want to, even if you want to do gallbladder or the appendix, they wouldn't want you to do it because not only it's just the OR, but they didn't have staffing, and they don't have staffing. So now this kind of gives you an idea about why there's this OR block time issue. Now I'm going to actually tell you why this issue happened at Mayo Clinic. So what we discovered in our case, we were given limited resources when we were doing our cases. And then, therefore, we weren't able to do many cases at same, like during our block time most efficiently. But if there's a very busy, efficient surgeon, let's call them, they were giving extra surgical pays, extra chief residents, surgical residents, to make that person, enable that person fully. So that way, that surgeon would start procedure here and go and start the other procedure there. Someone would close this one, he would start his third one. And then in 2 hours where he could do only 1 or 2 cases, he could do like 3 to 4 cases. This is a perfect example for that.
Bouncing around.
So now, I'm not saying that Christiana Hospital has the same problem, but I can see why this would become a problem. So, I mean, that's why I believe this is an interesting news for us, because many people also don't know when you sign the consent form, you have to really look for whether or not it's a teaching hospital. So because you may end up getting a surgery from a fourth year resident, because when you have, consent says,
I doubt they're reading it that carefully.
Yeah, because many people don't.
Yeah.
Well, many people don't, because I was the one who asked Christiana to update that form in 2015. So until 2015, everyone was signing. They didn't actually was giving authorization for the teaching resident to be able to do it. And then they updated in 2015. We have this in writing. So Christiana can call me if they need to see that in writing. So meaning we have these problems. Even the most innocent institutions or most known quality-wise, most known institutions, they do have these problems because there's always there's always some details that many people don't know, and those details can actually make other people rich. So you have to be careful with these things. Now, did we mention the insulin, the $35 a month insulin?
Nope. So that was actually another recent news article we came across. So Eli Lilly, the drug maker, are actually going to cap their cost of insulin at $30 a month for those patients. We know in the article that there was obviously other financial costs. We know that Eli Lilly is not responsible for all insulin, so people can get it from various other companies, but theirs alone at least was capping it. They said it's cutting that list price of mostly commonly prescribed insulins by 70%. So we know that there was an issue, I think in recent years, when people, especially during COVID, worried about getting their insulin, accessibility to it, and obviously the cost of that burden is put on these people who have to obviously take their medication in order to survive. So, it's not like they can decide, but this cost right here is obviously.
This issue with our case conferences, we know
definitely
when patients start these medications and they don't continue. Either they feel better or they cannot afford.
Right.
So we have seen both. And from United Medical ACO, we have social workers in these cases where we try to reach out to the patient to better understand why they have these problems. But the findings are, other than just, if they are feeling good, that's one thing, although we disagree with that, because if you have a chronic problem that's stabilized with the medication, stopping that medication is a big mistake, because the only reason you feel better is because you were taking that medication. Right. Now, the second part is we have our social workers find out that some of these individuals couldn't afford the co-pays and other things, so then they stop taking these medications. So, and that's an important item for us. Now, your favorite Senator Fetterman. So, what's happening with him?
I told you he's my favorite. So recent news. Most people probably heard of it, but we touched on it, I think, a week or two ago, that he did check himself into a hospital because he was battling depression. And we just think it's kind of interesting that we haven't really heard any official updates on his status.
He's in the hospital.
Yeah, but no. I was going to say that he's still. It's like I said, the title here is a mystery swirl because he's co-sponsoring legislation while he's still hospitalized. So to think, how's this person working from a hospital effectively, let alone at all, obviously concerning. And then I'm sure you're going to dive into it, but just on piggyback on that. Also,
I have a very different view on this one. So this is a job, right?
Yeah, you have to get
so
it done.
So when you actually, you run for it. You have to be a candidate and you have to be elected, and it's a job, and you have to be able to do that job. And you already knew your conditions, and then you still did. And then people elected you, fine. People are at fault as well, but doesn't he have obligations to do his job?
I would agree there. I would say yes. He knows that he's signed up for. You can't, I wouldn't say use this as a cop-out, but you can say, hey, I'm unable to perform because X, Y, Z. However, at the same time, I just think from the media sense, and we talk about in the media, once that's released, can we get a video of him cognitively saying, this is what I'm working on. Here's my plans. I'm getting better.
He's in the hospital.
Yeah,
but he was going to be in the hospital. This is I'm not. I don't want people to misunderstand this. So we help everyone in healthcare, right? But if they are taking obligations for future, with the conditions that is not going to allow them to do that job, then don't they have some responsibility to the public?
Yes.
Because they cannot do their job anymore.
Yeah.
Like if I was to hire a new director here for our like research business, and that person already had many health issues and they were already struggling to keeping up with their daily tasks.
Yeah.
So then for them to take that responsibility and then making me believe that they could do the job, now they are no-show.
Yeah, I see what you're saying.
How is that actually okay?
Yeah.
And if this guy was going to be a problem, like we could have Mehmet Oz instead of him, who would be most likely producing a lot, not just for Pennsylvania, but also for the United States.
Yeah, I agree.
So that's a shame that people are so greedy that they have to just run for everything. Yeah. And this guy, again, even his qualifications were kind of questionable.
I'd agree there too. Yeah, I mean, as you're saying, he obviously has some personal responsibility he's obviously aware of what his, status condition was going into it. And like you're saying, kind of selfish to run for a position where you know how many people are depending on you to perform. And obviously now he's dealing with this, but something to watch, keep our eyes on, see what unfolds there.
All right. So now our next topic. So I'm going to actually, I have my problems with the W's and V's. So I'm going to share this PowerPoint first. So then let's start with this is not a new topic for us, right?
No, I think
woke
it's been
culture.
sprinkled.
We've been talking about this.
Yeah.
Wokeism. So what is wokeism?
Yeah. So, I mean, this is new to the dictionary. I think it was 2021, 2020. Put in there saying it's promotion of the liberal progressive ideology and policy as an expression of sensitivity to systemic injustices and prejudices. And that word's obviously being thrown around a lot more in the media and news coverage that you're seeing, whether it's, your daily talk shows, people on podcasts, but wherever you're getting your news from, you're seeing that this term and kind of what's behind it is becoming a lot more prominent in our daily culture, at least of the last recent year, 2, 3, I would say.
So we have a couple generations, I guess, if each generation was 10 years, or
I know, it's more than that.
More than that.
Yeah.
So let's say you are an earlier generation than I am, right? So for a young person who just got out of college for like 18 months ago, so this may mean something a little bit different for you than what it is for me.
Sure.
So and you may have more younger friends who may be able to relate to this a little bit more. So what's your take on that?
Well, from a political stance, just in general, for like the media.
Both, I guess.
Okay. Well, from a political stance, I know obviously it's supported heavily with liberal ideologies in that corner. And I think some of the things that are focused primarily with this wokeism specifically is more on like gender and I would say like racial injustice and prejudice is where they're kind of focused. A lot of when people say wokeism, they're usually not referring to economic policies that person necessarily follows. It's kind of focused more on those two areas is what at least I take from it, because based on the news that I'll be seeing, the debates or topics that are surrounded with this word coming up are usually regarding like gender.
So what's
race.
The first thing that comes to mind when we say woke culture? What's the first thing that you just like, if you feel comfortable, you can.
I would say it's not extremist, but kind of like more radical in the one end. I know like you'll see videos of people like at certain like protests where they're like screaming, going to like, in my opinion, excessive lengths to kind of get their message or their stance across. I just think it's a more heavily.
So so when I was like, if someone was to ask me that, my first like relation to the woke culture is the whole issue of transgender issue that started with the bathrooms and all that back in
the inclusion, all that.
So now everyone knows my position in these issues. I consider myself very liberal when it comes to this. not only that, but I do respect everyone. Part of our this YouTube show, we have Sarah McBride, who's one of the first state senator, transgender state senator, and we had 3 sessions with her for different reasons. And the first session was extremely emotional, at least for me personally. And I want to make sure that people understand that we are not against the idea of respecting others. At least personally, I'm not. But the limits, how do you actually draw those lines, and where to say, okay, this is enough, or like not enough necessarily, but this is okay, this is reasonable. So this all started. I mean, you and I, we did a lot of reading for Leah Thomas. Is it?
Yeah.
So Leah is taller than you, right? She's well, you and Leah are about same
Bring
height.
her on the show,
right? 6'3".
Yeah,
okay.
6'3".
So she was a swimmer, right?
Yeah.
So because I asked you because you were a college athlete, so then you can relate to those. And she one day just ruined. Well, I say she because she wants to be called she, fine. But then she one day ruined other people's dreams to make this personal statement about herself. So that's where I think when we say reasonableness, that's what we are talking about. So when there's Sarah McBride who's a role model for many people, regardless of their gender, and then there's Leah Thomas who's cheating the system. She still has her penis and other things, and then she's actually racing, competing in the women's team and the girls team.
Yeah.
So this is how actually it became a little bit more problematic, right?
Yeah. And just as you touched on that, though, with like the sports, I know a lot of people on the one end will say, no, like everyone deserves their fair chance. And, if Leah wants to race, she identifies as a woman, then she should. But if you kind of zoom out and look at the grand scheme of things, once enough, like obviously, like I don't know if you remember, but the video, like I think she was winning by like overlapping these people by like 3 times down and back. Like it wasn't even a close. It was like 40 seconds.
Well, she was number 420 in
the men's
rankings. And then she was a record-breaking swimmer.
So if enough men then transitioned or identified as a woman and competed in women's sports, essentially you'd be eradicating women from women's sports because obviously physically they couldn't be able to compete and rank if you're competing against a biological man. So I just think for those.
Well, the problem is like remember that whole education that we went through. I didn't realize that you could still have your penis and then just be a
I mean, you still have certain hormones being produced.
Yeah, but then if I have kids, and then if they use public bathroom, I wouldn't want my kids in the same bathroom with someone who's identifying in the woman's bathroom as a woman, but they still have a penis.
Yeah,
like, can we actually not say this? Like, is everyone so scared of saying this?
Yeah.
So I wouldn't want that. I don't have kids, but I wouldn't want that.
Right. I know that for some bathroom, I know there was like a gender exclusive, or it might just be like a one stall where it's like you lock that one door behind you, or you need to go to the bathroom, it's just you in there. But say like at a public gym, if you're in a locker room, and I mean, I don't know where that threshold, like you're saying, how long do you have to feel a certain way to be like accepted? But like, let's just say, if there's a time frame on these things, like if I went into the women's locker room because I felt a certain way, like, would that be accepted? Like, can they say anything to me, or is it okay?
There was a South Park episode for this. So
yeah, I mean, same thing. I mean, just using bathrooms, it's like you can't. I feel like it's almost, you're saying this modern thing. People are afraid to stand up and correct people because they're, I guess, this cancel culture of, oh, you said something, now you must be a terrible person, and you must also stand for all these other things.
What became a bigger concern for me, and I'm going to share the screen because I want to make sure that people are able to see exactly what I'm talking about. Now she calls herself Rachel, right? So
yeah.
So this is the highest ranking openly transgender official. Now this person was a man before. They still have their penis. So I don't know. Today is the penis is the
hot topic.
The hot topic. So and if you actually, because I'm sharing the screen, if you guys are able to just follow this, and the way that it was, like the way that she's talking about how we have to not only accept, not only be okay with, but we have to celebrate.
Yeah.
Now it becomes like now the celebration issue of if I don't celebrate it, I'm not, like I'm part of the cancel culture.
Yeah, you're terrible if you're not
Like
celebrating.
Sarah McBride is not going to come to the show anymore. Like if we don't celebrate. So this is, I separate that from Sarah McBride because Sarah actually did not actually talk about transgender issue in the beginning because she said she's not running based on that. She's a person and she wants to serve.
Exactly.
But when you make this, like this person, Rachel, what's her last name? Levine. Rachel Levine. So when she is forcing me to celebrate something that I don't agree, then that's where we actually become kind of like now we have like we are way out of line. I think like this is getting out of control. Now we see this in the pop culture. And I try to understand. I'm like, I must be getting old. Like, am I not able to relate to these people anymore? Like, I remember the Backstreet Boys, the Justin Timberlake, the NSYNC, and all those. And then we didn't have this cross-gender issue where it's being so available to the kids. Now you see Harry Styles wearing a woman dress, and then that's being celebrated. Right, there's a huge, and people are admiring this. So, and then was it Kid Cudi? Kid Cudi, like he's like just because he's following that, you wouldn't expect that from him, right? And the video is running. People can see what we are discussing, what we are talking about. So this becomes a big problem now. Like the picture that we have just now.
Yeah,
these are before and after, and then you actually prep these for me. Like, what do we have here?
Yeah, so I mean, you're seeing the other example on the screen. Sam Smith, very well-known singer, kind of just I don't say getting tied up in this new pop culture, but as you're saying, it's just seems to be being pushed, like in especially the younger, because obviously the younger generation, teenagers with social media and the fact that they're following these celebrities who they're looking up to, but just being like pushed in the face. And it's weird because as you're saying, back in the time, this wasn't as prominent, it was very uncommon. I mean, there definitely were well-known people who maybe dressed a little bit out of the norm or acted certain ways that weren't necessarily fit, so to speak, for their style. But now it just seems like it's almost all of them are kind of just like following this like neutrality of not trying to be a part of any, it's just like a me type thing.
Well, it's concerning. So, the other thing that with this, like making it so okay, like normalizing it, like I use normal. I know normal is not one of the words that we use, but making it so common.
Yeah. Like saying it was rare back in the day,
and then just saying that like every TV show now has like the characters that has similar, identification, just so that they can actually reach out to certain. But the kids don't know to actually want this, so we are actually forcing this to their face. So they are saying that there's a demand, but there's really no demand. Demand is being created by making these things available 24/7, and I think kids don't have proper discipline these days in terms of like what they have access to, who they watch, and then I think we are maybe creating a monster generation for the future.
And I would definitely put some of the responsibility on the parents too. I mean, I've seen videos where a parent will be recording their child, and they're saying the kid's like 4 years old, and saying, I identify as this XYZ. And it's like, how would that kid even know? Like, they're not even at puberty, and they already are, I feel this way, and I'm going to be like, I think
you're not allowed to drink until you're 21, but you can start hormone therapy at age 14 is a problem.
Yeah, I agree, right? You can't get a tattoo till you're 18, but no, we can theoretically mutilate your body if you want to get an operation for a sex change way younger.
So, but I think I again blame the media a lot with this. So, Don Lemon. So, who's Don Lemon? He's a
Don Lemon, yeah.
Lemon. I call him Lemon for whatever it is. But
Well,
Lemon, okay, Lemon.
sure.
So he's a CNN anchor.
Yes.
Was CNN anchor. So he's
still
on
is.
training now.
He kept it. Yeah, he kept that job. He wasn't.
But
he
isn't
wasn't
he
cut.
training for since?
Yeah, I think he returned Wednesday. It said he did have his comment where he was talking about how women aren't in their prime. I think the woman he was.
She was talking about. I mean, he was talking about Nikki Haley, right?
Yeah.
So, and who's Nikki Haley?
I know she's was
running for. Is she a Democrat?
Yeah, Democrat. Yeah. Okay. So I know.
So he actually hit the wall with this.
Yes, because normally,
if she was a Republican, normal media wouldn't care. But because she's a Democrat, and because she's a she, then everything was kind of like all the eyes were rolled over to this guy. Now, can I actually just share some stuff that I know about what he was doing before and after? So in the Obama years, he was openly blaming Black background, like people, the African Americans, for their failures. Because he's Black, so he's able to, he has that freedom and liberty to say whatever he wants to say. So he was saying this on CNN. So he was saying that Black people need to pull up their pants. He said, this is Don Lemon saying, he was saying that they need to finish school, they need to clean up their neighborhood. This is him saying this is in the Obama years. So then it got into the Trump years, then all of a sudden, that was untouchable anymore. So you couldn't say anything negative about Black people, and he was not saying anything. And he was actually blaming all the Caucasians. Then now, he actually took it to a next level. He actually, he thought he was in the safe harbor, and he was not. So he actually hit on the privileged, entitled white woman, which most of those are apparently Democrats. So that's statistic. That's not my opinion necessarily. So now he's not being welcomed anymore. So this all happens in the last 8 years. So this woke culture is almost like how it started and how it's actually taking generating some momentum for others. This is the same thing that how it's changing, and then how media actually taking a different position on these issues, depending on who's in charge and what people should be hearing, not like what people want to hear, but what people should be hearing. That's one of the, I think, issues that we have to address. The like 90% liberal media is not okay for any society. So because you can balance this off. Yeah,
I think another takeaway just of this is it feels like anytime, I mean, even us right now, live streaming this, it feels like if you're going to be on any sort of program where anyone can, look back and reference it later, it's like, I feel like people think they're walking on glass and they have to be very, very careful. And maybe sometimes what they want to say, they're going to then filter it down into like 5 times over, where it's like, you're going to simplify it and make it so I'm not bothering anyone with what I say because I'm in fear of, the media all of a sudden.
Eggshells. Like,
it's like,
did I say something wrong? Like, well, no,
right.
I mean, people should be respectful, but there are certain things that you can only just say it.
Yeah.
You can actually notice it. You can pretend like there's a pink elephant in the room, and then you say, well, you don't see anything. That's not how the life is.
Exactly. And I think when people do say these things, they're not necessarily saying it to offend someone. I mean, if you're just stating a fact is a fact. I'm not saying it with the intention of I'm going to offend you and make you feel terrible and, put you down. It's like, to be able to, freedom of speech is obviously a big thing in America. And I think to be able to just openly talk and discuss and debate things, like you're saying with the fact that they have to celebrate now, you're being pushed to celebrate, when we're talking about.
No, I don't want to celebrate anything.
Yeah. But
including birthdays. So
no birthdays this year.
They're not going to happen. So, but you can force it on me. That's the other thing. Like, you can't ask me to do something that I don't feel.
Agreed.
To celebrate, like, that's extremely artificial. Even like someone like Bill Maher is rejecting the idea of being forced by the media. And then he's actually openly talking about and criticizing the woke culture. That you wouldn't expect him to do that, because he's one of those most liberal people out there.
Comedian, liberal, you'd think.
So now out of this, from every time there's a crisis, there's always some silver lining. And I'm not saying this is a silver lining for me in any way, but I see a new, maybe future star. Is it on this video or the other video?
It was on the beginning of this one.
New, perhaps future, maybe running mate for one of the presidents, Vivek Ramaswamy, right? I took that name now. Hold on, let's share so that people can see. So let's read this together. This is Vivek Ramaswamy. And I'm really good with Indian names, so because we have a lot of Indian friends and doctors. So now he's rising these days as an anti-woke person. So tell us about what's happening.
So I think a big push with him in the campaign is the fact of him being in the younger generation. I know with our current President Biden and people even saying on former President Trump that age was a concern for them. Biden in his 80s, and then Trump, I think, is 76 now, maybe
77, maybe.
But so him being much younger is obviously an appeal, and I think that it may draw to the younger generations that he can relate to kind of them in a better way that former candidates may not have necessarily been able to. And as you're saying, that he's running on this campaign of the idea of the anti-woke, which I think, running your whole campaign on that, if that's going to be your approach, is like you're putting a lot of eggs in that.
The haircut.
Yeah.
His hair is really bad. Like something is happening right here. So he really needs to clean that up. So, but I think he may be on the right direction, because including my friends who are Republicans and who are Democrats, I would say 80% are thinking the way that I'm thinking about the woke culture, because they're worried about what's going to happen 10, 15, 20 years from now, because the kids are so vulnerable. So they are not, they need protection, and first their parents, but then our system needs to protect these kids. So they cannot process everything that the way you do or the way that I do. So, and then if we don't protect the kids, then we'll all have bigger problems in the near future. So this guy, I believe, is on the right direction. I don't know if he can be the next Obama, but what we know is based on their ethnicity, background, religion, we have elected people. Like we have someone like Kemal Harris, like she's a VP, and she talks to people like if they're in a kindergarten. Remember that whole bus, the school bus, the electric school bus, like you can charge your phone with the USB. She's so excited, and then the room is like age average is like 65. So like, why are you talking to people that way? But she did, because she's a little bit Black, a little bit Indian, a little bit Jewish. She has all of them. So then, okay, so she looks good as a vice president. So let's pick her. Now we have a prime minister in UK, Rishi Sunak. That was a surprising one. So, but it's happening even in England. This is now accepted. So this guy, I think, has a good chance to be maybe not next Obama, but he may be the running mate for someone.
Yeah, I watched a few of his videos. I thought he was well spoken. Seemed to have logic behind how he was answering questions, which obviously is a good thing. And he was able to actually, formulate good responses in real time. So I think he's a good shot.
Yeah. So, Sean, our big topic, actually, I want to start with that next week, because I don't think we have enough time.
I got about 10 minutes.
Yeah. So we can open it up a little bit. Maybe like we do want to discuss or bring up this Russia and Ukraine issue again, because central bank, I believe, they approve another 10 million, or the Federal Reserves, right? Person who went there. But US actually approved another 10 billion, which is bringing the total number, official number, to 120 billion, which is, well, at least 3 times more than what EU, European Union, is doing for this war. So this is becoming extremely costly. The reason we want to discuss this is because we all end up going to pay for this, at least from the financial side. So this is going to be reflecting on our taxes, which already is reflecting. This has already ruined a lot of pricing, part of the inflation, main reason for the inflation. But we wanted to kind of go back to the origin of this problem, and that's why we may need to discuss this a little bit more at our next session, is because right now we are already in this war. United States is the biggest sponsor of this war, with 140, almost 130, 140 billion. Yes, we didn't send any troops yet, but we have made a lot of things available. Now, I just want people to again remember what President Trump, what his position was about NATO. So he said NATO should be shut down. US is the only one that's supporting, but US does not benefit from NATO. And if he was to stay for another term, I think NATO was going to be dissolved. Now, all of a sudden, NATO became the center of attention, centerpiece for the globe, because there is a war right in the middle of Europe. No one is benefiting in terms of people who live around those countries are not benefiting. Who live in those countries don't benefit. Maybe at a country level, there are benefits because Russia is selling more expensive oil and gas. We sell more weapons and other things. But someone is paying for it, and this is coming from the idea of this, and the approval of the support and approval of this war is made by one political party, and that's the Democrats. So Biden okayed this. Now, I want everyone to kind of remember, I shared some of these when it was happening in 2014. Many people didn't actually even pay attention. Hunter Biden was a board member for one of the Ukrainian gas companies in 2014. People always focus on him, but another person was there, John, the state secretary of state in John. It will come to me. What's the guy's name? So his stepson was the partners with. So no one texts me yet. So let's see.
Son John Kerry.
John Kerry's son. So John Kerry's wife is one of the richest people in the United States. Heinz Ketchup. She owns that. So, and then his son, his stepson, and Hunter Biden, they are in a partnership in one of the investment companies, and then they became board members for Burisma, I believe the company name, in Ukraine. This is in 2014, in the Obama years, in the Biden's vice president years. The things changed, and I think there are some issues that maybe some technical issues that Biden had, Trump had while he was handling the issue. It became too politic, but he was on the right direction because he wanted the investigation, but he was forcing that investigation regarding Ukraine and the system in Ukraine who was allowing these things to happen. So Ukraine is the most corrupt, one of the most corrupt countries in the world, according to Bill Gates. So there's a video that I'll share that next week. So we just need to be a little bit more aware of what's happening. And therefore, just because something is started, some mistakes started, doesn't mean that it won't stop. This is costing a lot of people we displaced them from their home. This thing happened in Tigray. Many people know, and we know what happens with the earthquake in Turkey and Syria, and how much everyone is trying to help. But then on the other side of the border, we are killing hundreds of thousands of people from both sides, and we are all paying for it, and we are sponsoring. So we are going to actually discuss that a little bit more next week.
Yeah.
So it's 2:55 in 5 minutes. We have our Bariatric Friday, and we are going to discuss the day of bariatric surgery with Dr. Erkan. Well, until next time, please stay safe, and we'll see you soon. Bye-bye.